Thank you, Chairman. I'm talking about page 3 and to the real world evidence, especially Rivaroxaban in Asian population. Current guideline recommended that anticoagulation for patient with AF patient, but the European guideline and American guideline are a little bit different. And with the CHAS score more than 2, we should anticoagulation, but European recommend more NOAA than vitamin K antagonist warfarin. And this recommendation is based on the randomized control trial, and doctors and study controlled patient in this study. But many in real field, the doctors contact many patients, and the patients include more varied medical setting and more diverse patient population. So from the real world evidence, we can observe the result of RCT result. First, let's see the randomized control trial. Elias study is the first study of NOAA, and dabigatran is the first direct thrombin inhibitor, and 150 milligram was superior to the warfarin with respect to the stroke and systemic embolism, and significantly reduced ischemic and hemorrhage stroke. And next, the Rivaroxaban is the first factor 10A inhibitor, we so-called Saban agent. And this study, the Rivaroxaban showed that non-inferiority to the warfarin in preventing the stroke, and there is no difference of bleeding and same bleeding safety. Next, an Aristotle study, Apixaban. Apixaban showed that first superior to the warfarin, and Apixaban is less bleeding safety, so the Apixaban is more efficacy and more safety. And recently, the latest agent, Edoxaban, also showed the non-inferiority to warfarin and less bleeding and death from cardiovascular. In summarize, in NOAA agent, for the stroke, dabigatran is superiority, and Rivaroxaban is non-inferiority, and Apixaban is superiority. And in the bleeding, dabigatran and Rivaroxaban is less bleeding, and especially Apixaban is less major bleeding safety. So you easily think about the superiority of NOAA compared to the warfarin because of good efficacy and low bleeding. But we cannot use all NOAA for the AF patient, and same TTR score is the consideration. And if the stem TTR score is 3 or more, we can use the NOAA, and the NOAA is more beneficial to warfarin. However, in this score, including the race factor, non-Caucasian is 0.2 and female sex is 0.1. So Asian female patient is all patient take the NOAA. And surveillance of the previous trial, the risk reduction of stroke and bleeding were numerically greater in Asian than non-Asian patient, and the stroke and the dabigatran and ischemic stroke with dabigatran is superior, and in the hemorrhage stroke, Apixaban is more safety. And the Japanese rocket APCIS study, the Rivaroxaban is have a efficacy in the stroke, and especially in ischemic stroke, Rivaroxaban is more efficacious. And the bleeding and safety, and local AF in Asian patients is more safety, and in the IC intracranial hemorrhage is more safety. But the previous trial, phase 3 trial is not the same protocol. For example, local AF has the suboptimal anticoagulant period, and the next study, Aristoteles, and they used the two breaching period. So a little bit different protocol and a little bit different result maybe we consider about that. And the baseline characteristics, their cardiovascular is not the same. And Aristotle and Eli is a low cardiovascular, and look at AF study, Rivaroxaban is a high risk, include high risk patient. And mean chart score is 3.5 in local AF, but in other study, mean chart score is only 2.1, 2.8, and 2.1. So patients in the local AF have a higher risk of stroke and then patients in other trial. So it's difficult of head-to-head comparison among NOAC, and you need for real world evidence, especially Asian patients. From the well-organized registry, Garfield AF, you can show that from the 2012, NOAC use is increasing dramatically. And next to the real-world study, Jantus is a real-world prospective and observational study. Patient with Rivaroxaban, and this study enrolled in the North America and Europe. And the result is, interesting point is that the stroke event is less than 1% per year. Even the patient, cardiovascular 4 or 5, a high-risk patient. Because of the Rocket and Jantus study, the baseline is different. Chart is low, and prior stroke history is less. So the stroke event is less than in Jantus study than the Rocket AF. And Janap study is focused on the Asian population, including South Korea, Taiwan, and Hong Kong. And this study, very few patients experienced major bleeding, death, and stroke, and stem embolism. And also in this result, the stroke event is less than 1.6, even in patient cardiovascular 4. So in this study, Janap study, investigators conclude that outcomes broadly consistent with from the previous phase 3 local AF trial and better and Eastern Asian analysis and Jantus real-world observation, even when the difference in baseline risk factor. And in the previous local AF, bleeding is higher in the Rivaroxaban, but the Janap study, the major bleeding is lower than the Jantus, Rocket, and Asian AF study, Rocket study. This is unpublished data of Korean, but it's a big data from Korean medical insurance data. AF patient 1 million people. And 2 years ago in Korea, the NOAC can be under the medical insurance coverage, and many doctors can use the NOAC at low cost, and NOAC use is increased dramatically, but it's not enough now. But because of the higher patient cardiovascular more than 5, the NOAC use is only the 50%. And this graph is so interesting. Cardiovascular correlation with strong risk, and this correlation is based Western people, a small portion of Asian. But this graph showed in only the Korean, 1 million Korean people, and this correlation is well matching to the stroke event. And interesting point is Cardiovascular 7, 8, 9, the stroke is even, no increase in the Cardiovascular 9. And this is a NOAC stroke event, Apixaban, Rivaroxaban, and Divartra. The three NOACs is not inferior to the warfarin and less bleeding. In summary, the need for individualization of optimal choice NOAC is increasing, especially in Asian population. But the real-world evidence data of NOAC, including previous I tell the Rivaroxaban, broadly consistent or better outcome with the previous phase 3 trial. However, up to now, it's not enough for Asian real-world evidence, so further study is needed, for example, indirect and direct comparison among the NOACs. Thank you.